Welcome back to the Deep Dive. Today, we're jumping into something lots of people are curious about, especially if you've ever wanted a brighter smile. Teeth whitening. It's super popular, right? One of the top cosmetic dental things people do. But, well, there's always that kind of nagging question hanging around. Can teeth whitening actually damage your teeth?
Ugh.
Okay, so let's unpack this a bit and try to get to the bottom of what you really need to know.
Yeah, and what's interesting here is, there's so much info flying around, but it's really critical to understand the details, how these treatments actually work, what the real risks are, if any. Our goal isn't just like a simple yes or no on the damage question. It's also about figuring out how to do it safely. Being properly informed is just so valuable for your health.
Right. So maybe we start with the basics, the mechanics of it. As we looked into this, it seems like the core of most teeth whitening involves peroxide-based stuff, yeah, like a hydrogen peroxide or carbamide peroxide. And these things basically go after the stains on the enamel, lightening the tooth shape.
Exactly. It's a chemical reaction, really. It tackles the discoloration right down at the microscopic level. It's actually pretty fascinating how it works. These peroxides, they release oxygen molecules. These tiny molecules get into the little pores in your enamel and the dentin layer underneath. And then they break apart the organic compounds, the chromogens that cause the stains by absorbing light and making teeth look yellow or discolored. So it's not like scrubbing. It's chemically changing those colored molecules so they don't look stained anymore. And when we talk about how you get it done, there's sort of two main ways. You've got professional whitening done in the dentist's office that uses a stronger gel, but it's all controlled, meant to be fast and effective. Then there's the at-home stuff, strips, trays you buy, whitening toothpastes. These use lower concentrations of the same active ingredients.
Okay, and that leads us straight back to the big one. Can it actually damage your teeth? From everything we looked at, the answer seems pretty clear. When it's done correctly, the answer is generally no. But that done correctly part feels really, really important here, doesn't it? Like, what goes wrong? What are the mistakes people make that could make it risky?
That's the absolute key distinction. Potential problems almost always come down to misuse or just doing it way too much. What we often see are temporary side effects. Tooth sensitivity is probably the most common one. Your teeth might feel zingy with hot or cold or sweet things for a bit, but that usually fades in a few days. Another temporary thing can be gum irritation. If the whitening gel gets on your gums, it can cause a little bit of burning. Again, typically short-lived, reversible.
Yeah, that temporary sensitivity. I remember a friend describing it like tiny little ice picks. A bit dramatic maybe, but it shows that even temporary stuff could be pretty uncomfortable. But beyond those temporary things, the info we reviewed really stresses that using these treatments too often or, not following instructions properly, that can lead to longer-term issues. Things like enamel erosion or increased sensitivity that sticks around.
Right.
So it's not the treatment inherently, but how it's used or overused. And for people trying DIY methods, there's also that risk of things looking uneven, right? Especially if you have fillings or crowns. Those won't whiten like natural teeth.
That's exactly right. Your natural tooth structure is porous, so the whitening agents affect it. But things like porcelain crowns or composite fillings, they're not porous in the same way. So your natural teeth get lighter, but the restorations stay the same color. It creates this mismatch. Sometimes we call it the piano key effect, which doesn't look great.
Yeah, the piano key, look, definitely something to avoid. So, okay, professional advice seems pretty critical then to dodge that. Which brings us to, how do you whiten safely? What's the best approach?
Well, the main advice is generally to opt for professional whitening if you can. Dentist-supervised treatments tend to be safer because they control the application and use the right concentration. Plus, they're usually more effective, and it's really vital to avoid overuse. Don't go beyond the recommended frequency. For professional whitening, that's often like once every 6 to 12 months maybe. Your dentist is the best person to guide you on your specific schedule.
So it's the protocol, not just the product.
Yeah.
Makes sense. And that's where the professional guidance really pays off, I guess. Something that kind of jumped out at me from the material was a practical tip. If you do get sensitivity, using a desensitizing toothpaste one with fluoride or potassium nitrate can really help manage it.
Good point.
And apparently, right after whitening, it's a good idea to steer clear of really acidic things, like citrus fruits, sodas, because acids can temporarily make enamel a bit weaker, which you probably want to avoid right after a treatment.
Yeah, that's smart.
And of course, the baseline is always good oral hygiene, brushing, flossing, regular dental checkups. That keeps everything healthy regardless.
Absolutely. And building on that, while whitening is safe for most people, it's really important to understand it's not for everyone. For instance, if you already have really severe tooth sensitivity, or maybe your enamel is quite thin or weak, whitening could just make those problems worse. It's also generally not recommended if you've got active gum disease or cavities that haven't been treated. The whitening agent could irritate those areas quite badly. And like you mentioned, those dental restorations on your front teeth, crowns, veneers, fillings, they just won't change color with the rest, leading to that uneven look we talked about.
Okay, so let's wrap this up a bit. What does this all mean for you listening right now? Well, it means you're hopefully feeling more empowered with the facts to make good decisions about your smile. The bottom line seems to be teeth whitening, when it's done the right way, is generally safe. Yeah. The science is pretty clear: peroxide breaking down stain molecules. We've talked about the difference between professional treatments, which are usually stronger and faster, and the at-home options that use lower concentrations over more time. And yeah, temporary side effects like sensitivity or gum irritation can happen, but the big warning is about misuse and overuse, which could potentially lead to things like enamel erosion.
And if we sort of connect this to the bigger picture of oral health, it's really clear that yes, wanting a brighter smile is totally understandable, but knowing your own mouth's condition, your individual oral health status, that's the absolute most important first step before any cosmetic procedure. Remember those conditions we mentioned: severe sensitivity, weak enamel, active gum disease, cavities. Those are real reasons why whitening might not be right for you, at least not right now. Your overall dental health has to come first.
Totally agree. And look, if you've listened to all this and still have more questions, or maybe you're thinking about any kind of dental procedure, could be just a regular checkup, maybe a full clean and brighten, or even bigger things like exploring braces or implants, the best starting point is always going to be talking to a professional. Get a proper consultation. Based on all the solid information we've gone through today, if you're looking for dental consultations or treatments here in Singapore, you could check out Smilepoint Dental Center. They seem to cover a whole range of things from teeth whitening. They mentioned options like intensive Zoom or an express kit with a home component right through to kids' dental care, treating gum infections, wisdom tooth removal. They even have options like laughing gas for nervous patients. You can find them at their Holland Village spot. That's 43 JLN Maris Saga, hashtag 0164, Singapore is 27811 Phiem. Or they also have a branch at Mapletree Business City, which is 40 Pasir Panjang Ard, hashtag 0242. Singapore 117383. Okay, that wraps up our deep dive on teeth whitening. Thanks so much for joining us. We really hope you feel more informed and confident about making choices for your own smile.